Hello everyone, I'm Dr. Ros Taylor. I'm a palliative care doctor, and I'm going to talk to you today about how we would recognise that a patient or somebody you love is approaching the last weeks of life. Now, these journeys towards the end of life are all unique, individual, and depend very much on the person's personality, their illness, their age, who they're living with, their mind, their spirit. But there are some clues to the fact that somebody might be deteriorating and maybe in their final weeks. Things like somebody is moving less, is spending more time in bed, is sleeping more. Their appetite is going and they may be losing weight. They might find it difficult to swallow all their medication. And perhaps spiritually, they are withdrawing from life a little, no longer able to have the energy to do the things that they previously enjoyed. So perhaps this is the time to use the good days, the lucid moments, to have the conversations that you've possibly put off having. These are brave conversations about what is still important to achieve in somebody's time left. Perhaps whether they want to allow death to take place naturally, whether they want to die at home in their own bed, or what their wishes are about their funeral. But it's also a time to reflect on somebody's life, their legacy, the messages, their memories, talk about holidays. Just use this time for special moments. I'm now going to talk about how we would recognise that somebody is in their final days. So by this time, most people at the end of a long illness are in bed all the time. They will be lapsing in and out of sleep and deeper sleep, and they might even be unconscious for periods where you really can't wake them up, and then they wake up and have a few sips of fluid. Often swallowing is really difficult. If that's the case, then all that really matters is good care of the mouth. Perhaps ice chips or tiny sips of fluid from a teaspoon. Circulation might be slowing down, so hands and feet might feel cold, and the person's pallor might change. They might look pale or even look a tinge blue. They may also be struggling to breathe. This can be alarming, but it won't be painful for them. People often worry that pain will be worse in their final days, but that's very, very rarely the case. And there are different ways of giving medication if somebody can no longer swallow their painkillers or medicines to keep them calm. So, more sleep, less to eat. This can often cause conflict, but you need to be reassured that in the last days of life, people's appetite and thirst is much less. They're not missing their food or their fluid. It's a really precious time, and really the focus should be on sitting with your loved one if you can, and remembering that hearing is the last sense to go. Just soothing music or soothing conversation is all that's needed. And then eventually the heart stops and a final breath happens. So this is a difficult story to tell, but it's one we've lost familiarity with. We're not in the presence of people taking their last breaths. So I hope this video will help you feel more confident to be with those you love in their final moments.